I'm Dr. Sian Cole, Senior Health Psychologist, and today I'm going to be doing a video on Choice Point. Choice Point is an acceptance and commitment therapy exercise that can help us work out what to do when we're faced with a challenging situation. Now, we all know that life is very good at serving us up all sorts of difficult, challenging situations, and there's just no avoiding them. But what's important here is what we do when we're faced with a challenging situation. It is common to have all sorts of thoughts and feelings, particularly unpleasant ones, when we're dealing with a challenging situation, but we can't choose what those thoughts and feelings are. But what we can choose is our actions, and that's what Choice Point is all about. So in this video, my example is going to be getting a cancer diagnosis. So it is easy to understand that you're going to have all sorts of emotions and thoughts that come along with getting a cancer diagnosis. These emotions could be anxiety, fear, sadness. And if you want to understand more about emotions, I do have a video on that, so go and watch that. But it is still relevant to understand our emotions in regards to dealing with the Choice Point exercise. But also thoughts play a big part in this as well. So some examples of some thoughts when you get a cancer diagnosis is, how will I cope? What if I die? Will my hair fall out when I get treatment? But what's important here is what we deal with, how we deal with our thoughts and our emotions, so we can act in a way that is helpful and moves our life in the direction that we want to. So that's our choice. Our choice is engaging in behaviours that move us towards meeting our needs and acting by our values, or our choice is to engage in behaviours that move us away from our values and our needs. So for example, you could imagine that you might be trying to avoid your unpleasant emotions such as anxiety and thoughts about I can't cope, and you don't go to your doctor's appointment, then that's going to be leading you away from meeting your needs and your values. However, if we learn some strategies on how to unhook from our thoughts and sit with our discomfort, that can free us up to engage in behaviours that move us towards. So we can have thoughts of I can't cope, I might die, and still attend our treatment. And that's what some of the strategies we learn in acceptance and commitment therapy, so we can do that. So you might hear about diffusing or unhooking from your thoughts, so you can choose your action, and you might hear some words like acceptance or making peace with your emotions, even if they're uncomfortable, again to allow us to move towards our values.